The other thing that I was thinking about in terms of what can cause problems with sleep is sleep apnea. People who maybe are really heavy or snore loudly, it's a pretty obvious thing that maybe they should get tested for sleep apnea, which is periods of time where you pause breathing or don't breathe sufficiently, which decreases your oxygen levels, which causes various neurological and cardiac issues, which then cause problems with sleep, which compounds those problems. So we have found that people who are not overweight, who don't necessarily have a thick neck, that was what the theory was for decades, that, classically the guy who's got a big neck, is heavy. We thought that that's like a necessity in order to have sleep apnea. And that, unfortunately, is not true. People who are thin and athletic can have sleep apnea. So the question would be like, well, when should I be concerned that that could be a factor? Well, if you have a partner or a family member who says that you snore and they think that you pause, there are pauses in your breathing, then that could be something that's concerning. If you wake up with a headache, a lot of times that seems to be a sign of low oxygen at night and increases the suspicion of sleep apnea. If you're excessively sleepy all through the day, that is another reason to possibly suspect sleep apnea. And kids can have sleep apnea too. In fact, I spoke to an expert recently who works on helping people with sleep apnea, trying to cure that, essentially, treat it. And he said that kids who have sleep apnea that's not treated have ADHD symptoms pretty consistently. And so it makes sense. You're not getting sleep, brain's less organized, all the cleanup that happens when you're supposed to sleep isn't happening. And so that can lead to a lot of the symptoms we associate with ADHD. The part that was surprising to me is that I just never really thought that we would be looking at sending kids to have sleep studies to check and see if they have sleep apnea. There's an insightful comment here about sleep apnea. And so sleep testing, home sleep testing, is usually the first step in evaluating for sleep apnea. Now, of the problems with sleep that are not related to kind of state of mind or mood symptoms or, psychiatric conditions, of the things that are not that cause sleep problems, the vast majority of them case-wise are obstructive sleep apnea. But there are other things that constitute sleep problems. I mentioned narcolepsy. That is a sleep problem. Restless leg syndrome. That is a sleep problem. Parasomnias, which are, night terrors are a parasomnia. They are complications, sleep complication, which sometimes are hard to distinguish from PTSD. But either way, that is something that you wouldn't be able to test with a home sleep test. So there are, for other conditions like that, where they have to assess the brain activity, you would be sent for an in-hospital or in clinical setting polysomnography, which is the gold standard for sleep testing. And as the determination as to whether that's something that's appropriate should be done by a neurologist. And neurologists are the sleep medicine specialty is predominantly neurologists. There also are some respiratory doctors, some pulmonologists who do that. There are some ENT doctors, ear, nose, and throat surgeons who are sleep medicine specialists. But essentially, if you're looking at whether polysomnography in hospital sleep testing is appropriate, those are the folks that you would go to try and determine that.